My name is Dr. Deirdre Carver Raffa. I'm a veterinarian at Town and Country Animal Hospital in Naples, Florida. I've been a vet for 23 years, and my passion is reproduction, but I'm also very interested in the human-animal bond. What I would like to present to you today is a topic about One Health. One Health is a movement that's been going on for about 20 years. It's a global movement, so we're only going to be able to touch base a little bit on the surface today and not really get real deep into things. But today I'd like to cover the definition of One Health, go through a little bit of some of the history behind it, 2 case studies, some of the barriers to One Health, the future opportunities that I see in One Health, the terms ubiquity, and then very briefly the Zoonotic Diseases and companion animals. So first, One Health. About 150 years ago, we started compartmentalizing the environment and what was going on in the environment, human health, and in animal health. In actuality, what goes on in the environment also has an effect on what happens in the health of people and the health of the animals. So One Health is the idea that these 3 systems are not isolated entities, but they're actually interdependent on each other. So the purpose of One Health is to enhance the cooperation and the collaboration between human medicine, veterinary medicine, and environmental professionals to work together. So way back in 460 BC, sounds like a big TV commercial, but Hippocrates said in his book Airs, Water, and Place felt that a clean environment had an impact on public health. Dr. Benjamin Rush, who was a co-signer of the Declaration of Independence and also a physician and educator, felt that there was a moral obligation for people to take care of animals. And he understood that a clean environment meant that the animals were healthier and that they would produce better and improve the economic livelihood of the people taking care of them. He felt that there was such an interdependence in that relationship that a course in veterinary medicine was included and within the medical curriculum at the college he was developing that eventually became the University of Pennsylvania. So in One Health, about 70% of the emerging diseases are zoonotic. And zoonotic means they're diseases that are spread from animals to humans and humans to animals. 2/3 of these emerging diseases are coming from our wildlife species. Diseases like AIDS, Ebola, West Nile virus, Lyme disease, and Sars are all diseases that are emerging that have made the headlines in the last 10 years or so. These emerging diseases actually quadrupled in the last 50 years. A big reason for that is that our human population, as it grows, it expands into new undeveloped areas and develops those areas. And that exposes us to more species that carry zoonotic diseases. So our first case is West Nile virus. So starting July-August of 1999, Wildlife Conservation Society, or WCS, became alarmed at the number of crows that were dying in the New York City area. And around that same time, the Bronx Zoo vets also noticed crows dying at the Bronx Zoo. In September of that same year, the CDC announced that there was a human outbreak of St. Louis encephalitis in New York City. However, there was no link made between the avian and human diseases, despite the fact that they were in the same area, they had very similar clinical signs, and the pathology that we were seeing were very similar. The veterinarians, when I was reading a lot of their interviews, were very frustrated with the situation because when they talked with the CDC, they were told it was a coincidence or just a vet thing. So, despite the request by the WCS to have the CDC look at the crow samples and compare them with human samples, their requests were denied. The CDC had said that they had a pre-existing commitment to look at only human samples. So the veterinary community pushed on, and they used the National Veterinary Services Lab to look at the samples, and they found a flaviviral type virus in the crow samples, which is West Nile. Our next case is SARS, or Severe Acute Respiratory Syndrome. So this kind of reads almost like a movie script. In November 2002, in the Guangdong province of China, there was a farmer who died. Unfortunately, no one determined the cause of death. However, a lot of other people started getting sick with the same syndrome. Enough so that it was reported on the internet through Global Outbreak and Alert Response that they noted there was a flu outbreak in China. So through the bureaucratic channels, eventually from November to January 2003, the World Health Organization, or WHO, finally generated a report in English. Now they can generate reports in several languages. Unfortunately, they started first with French, and eventually they got a translation into English by January. In February, the Chinese government finally admitted that they had an outbreak going on, but it took them from November to kind of put the pieces together through their government channels. Meanwhile, the rest of us that are living in the real world don't realize that these bureaucratic agencies are sort of bouncing information back and forth. And so people weren't warned that they were walking into an epidemic and a crisis situation. February 2003, an American businessman was traveling from China, and he developed this pneumonia-like syndrome, or symptoms, while flying to Singapore. And in fact, he got so sick he had to get off the plane in Vietnam, and he was taken to a Hanoi hospital and subsequently died. And then several of the medical staff that had worked with him developed the same symptoms, and they had the same issues. An Italian doctor identified this was a major situation and reported to the World Health Organization, and unfortunately he subsequently died. So February 2003, the disease spread at the Metropole Hotel in Hong Kong. The index case for that situation was a Chinese mainland doctor who didn't know he was infected or even been exposed. 16 people who visited the hotel were now also infected, and they went on and traveled to Canada, Singapore, Taiwan, and Vietnam. So finally, after all this is going on and the spread of all these diseases, March 2003, the World Health Organization finally issues that there's a global alert. Kind of like sort of herding cats. They're trying to put the genie back in the bottle at that situation, at that time. So after the dust settles, we had 17 countries involved, 8,273 cases confirmed, 775 deaths at a death rate of about 10%. So this leads us to our next topic, which is the barriers to One Health. As we saw in the West Nile case, that there was a problem of communication between veterinary medicine and human medicine. The CDC had a view of that it was just a vet thing, or that it was just a coincidence, and really didn't take the vet community for serious when the situation was going on with the West Nile cases. There's poor communication between medical doctors and veterinarians. There's poor communication with government agencies, and we saw that clearly in the Sars issue, that we had, the Chinese government, the World Health Organization, and nobody was kind of figuring out what was going on until we were several months into the outbreak. There were poor communication between health officials, the press, and the government agencies. In the West Nile case, the WCS had requested that they not release where the crow samples had come from because they didn't want people to avoid those areas, just because the crows came from the Bronx Zoo or from certain areas. Well, the CDC did not honor that request, and in fact they actually got the timeline confused and sort of made the Bronx Zoo the epicenter, which it was not. Some other barriers we have are poor human sampling and archiving of autopsy tissues during an outbreak. In the West Nile case, we really understand West Nile and crows because we have a wonderful library of tissue banking and saving those samples to see what was going on. Unfortunately, in the human side of things, we really don't understand how West Nile develops and how it progresses in the human body because we just don't have the correct autopsy samples stockpiled. I put time and travel in here, and that's just because by the time everybody kind of gets talking and figuring out what's going on, we've had too much time go by. And also people can travel. We had in that case in the SARS, we had people traveling to ultimately 17 countries involved. The other problem we see with some of the barriers to One Health are there's a different perception of what's the greatest zoonotic risk between human and veterinary medicine. So the humans tend to think there's other issues where we have in veterinary medicine a whole other list of things that we're concerned about in terms of zoonotic diseases. And then also there's no real clarity on who's responsible for teaching about zoonotic risk and prevention. So should it be the human doctor that talks to the patient with Lyme disease that you also need to be careful because your dog lives in that environment, or is it the veterinarian who diagnoses Lyme's in the dog that should be talking to the human about living in an environment where there's ticks that carry Lyme's disease? No one's really come down with that idea. So let's get to a more positive note. There's lots of opportunities in One Health. We need to increase cross-referrals between human and veterinary medicine. So we need to increase our understanding of zoonotic diseases, and that includes getting better tissue archiving and collecting these samples when we do have the outbreaks. We need to improve communication in our journals, conferences and health networks, and that's why we're here today. And we need to increase our cross-species surveillance and control. We shouldn't be just looking at just mosquitoes or just bats or just rats, but we need to be looking at how those vectors spread disease and what are the environmental factors that aid the spread of those diseases so that we can stop that issue. Other opportunities include comparative medical, epidemiological, and environmental research studies. So we need to stop these studies that look at just the medical, so what is going on with Lyme disease or what is going on with Sars. We need to expand that out and go, how is it being spread and what's going on in the environment that helps it to be spread. As an example, there's a HEPA virus that's in India, and it has about 38% fatality rate. The outbreaks have been very small, so you don't hear about it in the news. And what they found, it comes from bats, and what they found is that the bats were flying around and they were sipping from these containers that had saps that they were collecting from trees. So when they figured that out, they just put 6 cents, it cost them 6 cents to build these little bamboo screens that they could put over the containers that were collecting the sap. The bats couldn't reach the sap, they didn't contaminate the sap with the hantavirus, HEPA virus, and people stopped getting sick. So it's not enough to say that the virus is spread through bats. It's not enough to say that the bats are getting it or contaminating people through the sap, drinking from the sap containers, but you have to take it to the next step of what are we going to do to stop that spread. And in this case, it was just putting a bamboo mesh over the top of the container. We need to develop and evaluate new diagnostic methods, medicines, vaccines for prevention and control of zoonotic diseases. And then third, we need to investigate, there's a movement called ecology of disease, which is looking at how land development affects the spread of zoonotic diseases. Okay, so the idea of the ecology of disease is a group of universities have gotten together in collaboration with their efforts and their monies and people to try to map out where these new areas of potential zoonotic diseases could be opening up. So they're monitoring areas, particularly forested areas in the tropics, looking at the edges of the villages, looking at new mines and what's going on there, looking at the edges of new fields that they've created for agriculture, and then also the borders of where they're putting new roads in. So what they're trying to do is identify potential zoonotic diseases and identify these areas as potential hotspots, so that if there is a problem, they kind of have a heads up and are a little bit ahead of the curve if there is an outbreak. The other thing they're trying to look at is what is the human activity that's going on in those areas that may be exposing people to higher risk for zoonotic disease. One particular thing is how people butcher bushmeat and then eating bushmeat and trying to educate people that they're increasing their risk of exposure to these diseases. The other thing is that when they're building feedlots, they probably want to avoid putting feedlots where bats roost, because the bats a lot of them tend to be fruit eaters and they're messy eaters, and they drop food and so forth on these, in one case onto pigs, and the pigs get exposed to the virus. They amplify it because they have a much larger body than a bat, and they're also very similar to human in terms of genes, so it's very easy for the virus to jump from the pig to the human. And then the other thing we talked about is screening the sap collectors, and that stopped the spread of the HEPA virus from bats to people. So now I'd like to introduce to you the idea of zoobiquity. Zoobiquity is sort of taking One Health one step farther. There was a cardiologist, her name was Dr. Barbara Natterson-Howitz, and she was invited to the LA Zoo to look at some animals with heart issues and ultrasound them. And while she was there, she was really impressed with the veterinary rounds that she got to take part in, and the fact that a lot of the animals suffer from the same diseases that people suffer from. So the idea that she developed was to have conferences where veterinarians and human doctors who are specialists in different fields get together and present cases of animals and people that are sharing the same problems. So obesity, different types of cancers, different neurological disorders, obsessive compulsive disorders, erectile dysfunction, and different types of cancers. So the hope is that by comparing the diseases in the different species, that we'll be able to come up with maybe new treatments, new medicines, and different ways to look at these disease processes than just the traditional way we've been looking at them. And then this is just a long list of zoonotic diseases that veterinarians are concerned about. I mean, you don't have to go out into the jungles of Bolivia or to go out to Timbuktu to get exposed to a zoonotic disease. You can get them from your dog, you can get it from your cat, you can get it from your pocket pets, your pet birds, your reptiles and amphibians, and even your aquarium fish. So I'd like to thank the Southwest Florida Chapter of Hospice and Palliative Nurses Association for inviting me to come and speak to you today. And also Gwen Kolig, Diane Ehrlich, my co-speaker Judy Peters, Marianne Jarek, and then also the Town and Country Animal Hospital staff for listening to me while my practices. Hi, thank you for listening to my presentation. If you have any questions, just give me an email at towncountry@mynaplesvet.com. Thanks.